Hello and welcome to our COVID-19 update where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello Minister, thank you for joining us today.
Thank you very much for having me on the program.
Okay Minister, now let's begin with this weekend's drive-through at Movietongue and the National Stadium. What was the turnout like? Do you have the figures here for us this morning?
I think it was pretty good. Both sides we saw a steady flow of vehicles. On the first day, Saturday, we had about 735 persons who came to Movietongue, and at the National Stadium we had about 700 persons that came. So I think we had a good day, given that some people came by themselves in a car. We would prefer that more people would have come together to see carpooling, but I think it was quite successful. And on day two, which was on Sunday, we had 694 persons that came to Movietongue and 650 at the stadium. So I think, in summary, we've had quite a bit of success with this type of exercise where people are driving through and getting their vaccines. And a lot of people would have commented on the efficiency, the way they were able to come and get their vaccines quite quickly. I think a lot of people enjoy that. So we are going to examine and we are going to continue to do a number of these exercises. We will be consulting with communities to see where we can ideally place them. So in Region 4, we are already looking at a couple of other sites that we think would benefit some of the other communities in Region 4. We have already spoken to the people in Region 3, and next week we'll be doing a drive-through in Region 3. So the details of that, during the week we'll talk a little bit more about the Region 3 drive-through. And we're also working on one for Region 2 and one in Region 6. So as we develop these, we are going to give the details so that persons in those areas can come out and get vaccinated.
Okay. Minister, of these numbers, said the 700 and something each location and the 650, I think it was, these are both first and second doses?
Yes. So we saw a lot more people getting first doses. About 2/3 of the numbers were first doses and about 1/3 second dose.
Okay, Minister. Now let's look at the entire campaign. Can you provide an update on the numbers so far, preferably a regional breakdown?
So nationally, we have seen 220,997 persons receiving their first dose vaccine. And as you know, we are giving vaccines to people 18 years and above. So this represents about 45.4% of our adult population. And of those who got their first dose, we've seen 87,919 persons who would have received their second dose of the vaccine. This accounts for about 18.1% of persons 18 years and above. So I think we are making steady progress. Of course, we like the numbers to increase, but in some of the regions, we weren't able to do much vaccination because of challenges with flooding and so forth. But nevertheless, we are still keeping the vaccination program going.
Okay. And Region 6 and 1 are still leading? Because I know the last...
So regionally, for Region 1, first dose vaccine, they're at 53.8%. Region 2, they're at 42%. Region 3 at 44.8%. Region 4 at 47.2%. Region 5 at 48.6%. Region 6 has been overtaken by Region 1. They are now at 53%. Region 7 at 44.1%. Region 8 at 28.5%. Region 9 at 42.5%. And Region 10 at 13.6%. So this is our regional breakdown for first dose. Hopefully we can get more numbers during this coming week.
Okay, Minister. Now, I know Guyana is also expecting a shipment of vaccines from COVAX. Can you say when that will be here?
We're still waiting on a final date from COVAX, but from earlier correspondence, they had indicated that during this week, we should expect a shipment of approximately 38,000 doses of the AstraZeneca vaccine, but we don't have a final date as yet. As soon as we get that, we'll make that known.
Okay, Minister. Now, over the weekend, we learned that in Region 6, the region is being faced with a drug shortage. Can you say what may have caused this and what is being done to regularize the situation in the region?
As far as I'm aware, the region shouldn't experience shortages because we have been sending adequate supplies of medicines to Region 6. What I understood is that medicines might have gone to the region but have not been adequately distributed within the region. So that is something, since the president people complained to the president about that. We have been looking more closely and we are rectifying the situation. In fact, some of those complaints, we have already taken care of them.
Okay, Minister. Thank you very much for that. Now, today is World Blood Donor Day. How safe is it to donate blood during COVID-19?
It is quite safe, and we want to appeal to persons to come out and donate blood. I noticed that on Saturday at Movie Town, the blood bank also had an exercise there where they were canvassing persons to come and donate blood. You see, one of the things that we really need is blood so that persons who require surgery and persons who require emergency surgery at that, they oftentimes require blood. And if it's not in adequate supplies, then we can lose that patient. So we want to appeal to persons to come out and donate blood. This week it highlights the need for blood and why people should donate blood. And as you know, the blood bank, we have a program there where we can have persons who are regular donors coming in, and we want people to become members of that club, so to speak, where they can come in and donate regularly so that we can have a constant supply of blood. Every year we try to collect maybe between 12,000 to 13,000 units of blood. Last year we would have seen a decline in the amount of blood that we collected, and maybe about a 25% or so decline, and that would have interrupted some of the services that we usually offered. This year we are quite on track to collect enough blood, and hopefully with people coming out and responding and giving blood, that we will be able to have adequate supply in our blood bank.
Okay, Minister, since we are in the middle of a pandemic, can a person who is COVID-19 positive transmit the disease to someone during a blood donation?
First of all, this COVID-19 is not a blood-borne disease. So the only way you get transmission occurring, or the most popular way that you get transmission occurring, is through droplets or aerosols. So if you have someone who is COVID positive not wearing a mask, and the other person who was in the room with him or her also not wearing a mask, then the possibility you can have transmission because of the way that transmission occur. But getting COVID from the blood, that's highly unlikely. So in that way, people don't have to be fearful of that, because when you come to donate blood, we have taken all the infection protocol to make sure that people are safe. So if you come to any one of our donation sites, we'll be observing all the protocols for COVID-19, which means that You would not be able to get COVID, nor anybody in the unit would be able to contract COVID.
Okay, Minister. Now, if someone, we're still on this, if someone is COVID-19 positive but they're asymptomatic, can they still give blood?
We'll prefer them not to, but however, if they're asymptomatic, we wouldn't know. And one of the things that we do when people come to donate blood right now is we have a checklist of symptoms that we look for, and if anybody got any one of those signs or symptoms, then we would not allow them to donate. If they're asymptomatic, meaning they have no signs of symptoms, then we don't know. However, even if they donate the blood, right, they cannot infect somebody with the blood. And in fact, the blood probably would have antibodies inside that can be protective to the person who's receiving the blood. So that's something that, people should think about as well.
Okay, Minister. Now, when a person takes his or her COVID-19 vaccine, how soon after can they donate blood?
The protocol that we've been using is that if you're mildly symptomatic, within 10 days we discharge you. Say you're no longer a COVID-19 patient. Once you have been discharged, we normally wait, well, that's for somebody who is positive, right? So that's for somebody who is positive. If you're discharged, then you can wait for about 3 days after or so, and then we can take your blood if you want to donate. For persons who have received their vaccine, there's nothing stopping you from giving blood. You can go the next day to give blood. Generally, we wait at least 2 to 3 days. And the reason being is just to make sure that the person who has been vaccinated, just to observe to see whether or not they have any side effects from the vaccine and so forth. Because there's a small percentage of people who do have side effects, and you don't want to go donate blood if you're having some side effects. So that's the only precaution, but you can get a vaccine and donate almost on the same day. In a lot of countries, that is what happens. The vaccines that we are using here allows you to do the same thing. In countries that use a live attenuated vaccine, we don't have those. They will normally tell you to wait 2 weeks, but we are not using those here in Guyana. So you can, if you so desire, you can go almost immediately and donate, or you can wait a couple of days just to make sure that you don't have any side effects from the vaccine, and then you can donate blood.
Okay, Minister. Now, before we go, on this significant day, what will be your message to any voluntary blood donors?
Well, I just want to encourage everyone who is healthy enough to come out and donate blood, because as you know, blood can save lives of people, and we want to have adequate amount of blood in our blood banks so that those who require it can have access to it. So I'll just encourage everyone to make sure, if you have the opportunity of donating blood, please come forward and do so.
Okay, thank you very much for that, Minister, and thank you for your time today. This has been DPI's COVID-19 update. For more information, visit our website dpi.gov.gy and our social media platforms.